I think this also affects politicians a lot, because I can see my politicians, even in government, sitting and reading Twitter all the time in the government negotiations to look at the reactions that come out. And I have to say it probably did affect my minister quite a lot. She was extremely hardline. And she listened to those who were quite hardline. And we had to try to pull back on a couple of times, and a couple of times it did work, and a couple of times it did not work. And the way that they present themselves in the public also affects the mood of people. So we knew quite early on that children are not at particular risk immediately. And we tried to communicate that, but then if you have the media giving the totally different message, and sort of, are you sure, are you sure, are you sure? And it's very understandable that people are afraid for the health of their children, but they were also afraid of the children. And we saw this with the teachers. That was very scary, actually, and unfortunate.
We have 3 minutes over here now, but then I just want, when you hear this, the experts saying it was not dangerous to have your kids in schools and kindergartens, but you felt the pressure from the parents and you moved on that.
We didn't move on that. We moved on the advices we got, and we got clear medical advice that it would be a good thing to close down schools and kindergartens. But of course, in that situation, you have to act on what you know and what guidance you get. And I think one of the problems would be if you feel like I don't know what to do, so I'm doing nothing. And that was important to us during the pandemic. Okay, this is the information we get. This is the advice we get. We need to find some way, and we do it like this. Okay, maybe it's too much, maybe it's too less, but we have to do something. We can't sit here with our hands in our lap.
Thank you so much, and thank you for joining us from